Okay, today we're going to be talking about erythrocytes, blood types, and transfusion reactions. So erythrocytes, these are more commonly referred to as red blood cells. They are flat disc-shaped cells that are indented in the middle on both sides. This shape leads to a larger surface area, which allows for the diffusion of oxygen from the plasma across the membrane. It allows for more surface area than if this would have been a sphere-shaped cell. It also has a flexible membrane. This allows for them to travel through the narrow capillaries in your venous system without damaging themselves. Each of them contain a hemoglobin, which is made up of globin, a protein that has 4 highly folded polypeptide chains. 2 of these chains are alpha subunits and 2 of these are beta subunits. The other section of a hemoglobin is the heme group. This has 4 iron-containing non-protein groups. So there are 4 heme groups within an erythrocyte. So you can kind of see what images of those look like over on the left here. So the top left corner is an image of an erythrocyte. The bottom right corner is an example of a hemoglobin. So you can see the 4 folded chains. They're all different colors. 2 are alpha, 2 are betas. And within those chains are that heme group. So each erythrocyte, each hemoglobin can carry 4 oxygen molecules. Each of these 4 iron atoms within the heme group can combine reversibly with 1 molecule of oxygen. So it's important that it's reversible because you want to be able to combine with the oxygen, take it to the area that you need it, and then release it so that it can be used by the body. It's important also to note that these hemoglobin heme groups can also bind with carbon dioxide, acidic hydrogen ion portion of the ionized carbonic acid, carbon monoxide, and nitric oxide. So carbon dioxide is important because the hemoglobin will then help transport this gas from the tissues back to the lungs. This is a byproduct of cellular respiration. So it's released and then your body wants to get rid of it. The acid hydrogen ion portion of the ionized carbonic acid, this is generated at the tissue level from the carbon dioxide. So hemoglobin buffers this acid so that it's not going to be altering the pH of the blood. So it helps maintain that pH value that is needed in the blood. Carbon monoxide, so this is a gas that's not normally in the blood. A lot of people have heard of kind of carbon monoxide poisoning. A lot of homes have carbon monoxide alarms to check for it because it is an odorless gas. So if this is inhaled, it preferentially will occupy the O2 binding sites on the hemoglobin, which means if there's carbon monoxide in your blood system, you inhale it, it gets taken up by the red blood cells. The red blood cells are no longer transporting oxygen, they're transporting carbon monoxide, which can end up giving you carbon monoxide poisoning and end up killing you. And then the last is nitric oxide. So in the lungs, the vasodilator nitric oxide binds to hemoglobin. It is then released at the tissues where it can relax and dilate the local arterioles. All right, so erythrocytes continued here. So erythrocytes do have a shorter half-life. They do not contain a nucleus or organelles. This is to allow for more oxygen to be transported. Without the DNA, RNA, or ribosomes, however, the red blood cells cannot synthesize proteins for cell repair, growth, and division, or for renewing enzyme supplies. What this means is, since they can't repair themselves, they do not have a very long half-life. They only survive an average of 120 days. Erythrocytes are produced in red bone marrow. They originate from pluripotent stem cells. These stem cells are undifferentiated and they actually can become all of the types of blood cells that you have. They reside in the bone marrow where they will continuously divide and differentiate to give rise to these different types of blood cells. So how this process is initiated is reduced oxygen in the kidneys will stimulate the release of erythropoietin or EPO from the kidneys. This the lower the oxygen, the higher the amount of EPO that is released. This erythropoietin will then go to the red bone marrow, and this hormone will stimulate the production of erythrocytes in the bone marrow. And then the increased oxygen carrying capacity will then negatively feed back to the kidneys, and the kidneys will no longer be releasing EPO. You can see a diagram of this on the left-hand side here. All right, so RBC or red blood cell disorders or erythrocyte disorders. The first one would be anemia. So anemia is classified as a low oxygen carrying capacity. And this can actually be broken up into 6 different categories based on why there is a cause for the anemia. So the first would be a nutritional anemia. This is caused by a dietary deficiency of a factor that would be needed for erythropoiesis. So this depends on an adequate supply of this raw ingredient, which is not synthesized in your body. So you have to take it in through food intake. So an example of this that a lot of people have heard of is an iron deficiency. So when you have an iron deficiency and not enough iron is available, you're not able to synthesize hemoglobin, and then people have low hemoglobin in their blood work. The second is a pernicious anemia. So this is caused by the ability to absorb enough of vitamin B12 from the digestive tract. So vitamin B12 is needed for normal erythrocyte production. It is abundant in various foods. However, with pernicious anemia, you're getting it in, you're taking it in, but it's not getting absorbed by your body. The third kind is aplastic anemia. So this is caused by your bone marrow not producing enough red blood cells. A lot of times this is caused because of ingestion of toxic chemicals, heavy exposure to ionizing radiation, invasion of bone marrow by cancer cells, or chemotherapy. So that is one of the things that they kind of watch. You hear a lot of times with chemotherapy patients that they are watching for this anemia in case this is happening. The next one is renal anemia, which could be caused by kidney disease. As we said in the previous slide, the production of erythrocytes is controlled by the kidneys releasing that EPO to stimulate their production. So if the kidneys are not functioning in the way that they should, they're not going to be stimulating the erythrocyte production. Hemorrhagic anemia, it would be caused by losing a lot of blood. And then hemolytic anemia is because too many of the circulating erythrocytes have ruptured. The next disease is sickle cell disease. So this is caused by a genetic mutation. This mutation causes a change in the shape of the red blood cell, and it turns it into a sickle shape. In the top right corner, you can see an example of what that looks like. Once the red blood cells have this type of shape, it causes them to clump. This clumping can kind of create blockages through the smaller vessels, which can lead to pain or tissue damage around that affected site. These are also more fragile and they're prone to breaking apart. And then polycythemia is actually the opposite of both of those. This is when you have too many circulating red blood cells. So a primary cause would be a tumor-like condition where your erythropoiesis is just proceeding at an excessive rate. It just continues to produce red blood cells even though your body doesn't need it. And this doesn't really add anything to the oxygen capacity of your body. What it does is it actually changes the viscosity of your blood. So it's going to make it a lot thicker, which ends up making it a little bit more sluggish. So it's going to be moving slower, which can then actually have the effect of lowering the oxygen that it ends up getting delivered to the cells and tissues of the body. And then you have a secondary form, which this is just going to be caused because um, a lot of times it happens because of living at higher altitudes. So there's just less oxygen available in the environment. So your body is going to respond by increasing your red blood cell count to be able to really maximize how much oxygen it can take out and transport around the body. Again, though, this can cause your blood to be sluggish and thicker. So blood types, there are a few different types of blood. Your blood type is going to depend on your surface antigen. This antigen is a complex molecule that's located on the membrane that can trigger a specific immune response. So you have an A blood type, which would contain an A antigen, a B blood type, which contains a B antigen. AB blood have both A and B antigens, and then O blood means that it doesn't have an A or a B red blood cell surface antigen. The other thing that each of these blood types can have is something called an Rh factor. So this is just an erythrocyte antigen that could either be seen on the outside of your blood cell or not seen. So positive means that it is there, and then negative means that you do not have this antigen present. So you could have either A positive or A negative, B positive or B negative, AB positive or AB negative, and then O positive or O negative. So since these are antigens, what that means is they can create an immune response. So it's very important that when a patient is getting a transfusion, that they are getting the correct blood type that they need. A transfusion reaction can occur if they get the wrong blood type, which could result in agglutinated clumps of incoming donor cells that could end up plugging small blood vessels. It could also result in acute kidney renal failure, which would be caused by the release of large amounts of hemoglobin from these ruptured donor erythrocytes. This could range anywhere from minor to life-threatening in severity. The most common sign and symptoms of transfusion reaction are going to be fever, chills, urticaria, and itching. And this could be either acute or delayed. So it's something that you could see right away, or it's something that you can see after time. So treatment may not be needed depending on the severity. It may resolve on its own, or it could end up being fatal for the patient. Antibodies that are present in the blood donor can also cause reactions and are actually linked to something called TALI, which is transfusion-associated lung injury. And then something else that can happen, this is from that Rh factor that I was talking about. This is called erythroblastosis fetalis. So it's a hemolytic disease of the newborn. What happens is this is when the mother is negative, but the fetus is positive. So some of the fetal antigens are able to cross the placenta in the mother. This happens about 15% of the time. The first pregnancy, it's not really an issue. It crosses over. However, and then the baby is born. However, then the mom creates antibodies to getting exposed to this antigen. So it creates antibodies against this Rh positive antigen. Then what happens is the second time that she's pregnant, these antigens can end up going in and actually attacking the fetus. So this is going to end up destroying fetal red blood cells, and it becomes a problem because the fetus cannot always replenish the red blood cells fast enough as these antibodies are destroying it. So it can result in the release of bilirubin, anemia, hemolysis for the fetus. And how much it's going to affect the fetus depends on things such as how much antibodies produced by the mother, the gestational age of the fetus, and if the fetus is able to replenish the red blood cells or clear the bilirubin. But this can also be fatal for the fetus. This does get treated now with an administration of something called Rho-D immune globulin. What this does is it's going to prevent the mother from creating these antibodies against the baby. So this is given in about 28 weeks pregnancy, and then is effective until the end of the term. And that is a little bit about erythrocytes, blood types, and transfusion reactions. Thank you. Perfect timing.